Hi, my name is Kristen and I am here with Katie and Aiden.
Hi listeners, I am so excited to speak about schizophrenia, its effects, and how you can support those with this serious mental health disorder.
Kristen will begin by talking about the beginning of many journeys with schizophrenia.
Schizophrenia is a mental illness that affects a person's way of thinking, expressing emotions, behavior, and perception of reality. It is often associated with hallucinations, delusions, and an unorganized way of thinking. People may seek a diagnosis if they display the signs and symptoms of schizophrenia. If a person's behavior aligns with these signs and symptoms, they may seek professional help in order to improve their lives. Some physical signs of schizophrenia include moving slowly, a change in sleep habits, and a change in behavior. If a person has catatonic schizophrenia, which can cause a person to stay static for long periods of time, the person may hold unnatural positions for long periods of time or adopt unusual poses. After seeing a professional, the professional will use specific criteria before officially diagnosing someone with schizophrenia. These criteria include having 2 out of the 5 main symptoms, which are delusions, hallucinations, disorganized or incoherent speaking, and disorganized or unusual movements, and negative symptoms, and these symptoms must last for 6 months. A professional may administer an MRI to ensure that these abnormal behaviors were not due to brain injuries, tumors, or strokes. Blood, urine, and spinal tap tests will rule out heavy metal toxicity. Finally, brain activity testing will rule out epilepsy. Professionals are unsure of the causes of schizophrenia, however suspect that it is caused by genetics as well as the person's environment. After this initial portion of a schizophrenia journey, a patient may seek treatment in order to improve their life's quality. Let us learn what may precede a diagnosis, as well as how caretakers can support those with schizophrenia.
Schizophrenia can have a large impact on both the patient as well as the patient's friends and family. For the patient, schizophrenia can make it hard to go to school and work, to keep a steady schedule, and to take care of oneself. In order to improve the health of the patient as well as the quality of life, the patient can participate in psychotherapy, which is a training for dealing with their emotions, learning more about their mental illness, and differentiating their episodes with reality. The patient can also stay on antipsychotic medications. For the family and caretakers, the patient's diagnosis can trigger distress, hostility, critical comments, and feelings of guilt, shame, hurt, or anxiety. These family members can help the patient by acknowledging their feelings instead of dismissing them, encouraging them to do everyday tasks, putting themselves on the patient's emergency contact, following up on their treatments, and educating oneself about their disorder. Now Aiden will talk about the prognosis.
Whether the patient received or did not receive treatment determines the quality of their life in the future. Without support, it is more likely the patient will experience more intense symptoms, and it is possible that other mental disorders, such as OCD, anxiety disorder, and depression can develop. This relates to having an increased difficulty in maintaining healthy and close relationships with other people. Alcohol and drug abuse are also more of a risk to patients not getting proper treatment. When understanding schizophrenia, it is divided in 3 phases. The first one is the prodromal phase, describes the early stages of schizophrenia. Symptoms include sleep problems, lacking motivation, and irrational behavior. The second is the acute or active phase, is when the patient will start to actively experience symptoms. Symptoms include hallucination, disordered speech, and disorganized thought. And finally, the residual or recovery phase often occurs when proper treatment is given during the acute phase. In this phase, the patient will experience less or fewer severe symptoms and experience more negative symptoms. These symptoms include social withdrawal, difficulty in concentration, and general disinterest. Statistically speaking, 24 million people experience schizophrenia worldwide, or about 1 in 300 people. People with schizophrenia are 2 to 3 times more likely to die than those without. Onset usually occurs before someone's 18 and generally starts at mid to late 20s to mid 30s. Both males and females have similar prevalence of schizophrenia, though females typically have onset 3 to 5 years later than males.
While schizophrenia is a serious mental illness that affects 24 million people worldwide, it is definitely treatable. After recognizing the signs of schizophrenia, a patient can seek a diagnosis as well as the treatment options, including therapy and medication. Whether the appropriate steps are taken will determine the future quality of the patient's life. A few resources for schizophrenia include NAMI, which has a helpline, as well as the suicide hotline.
Thank you so much for listening to our episode today, and I hope we have successfully raised awareness and educated you all about schizophrenia. Thank you for listening.
Thank you.